Okay, so let's go ahead and get started. I think Carol was also going to join us. And before we get started, I just want to say that, so I'm Susan Hyde, and I had reached out to Abby and we connected, and I said, I would love for you to do a call for my team. And then I kind of went like, well, if I'm doing this call, then why not open it up to everybody? So if you are here, I am so glad, because we are all about sharing the information in a way that is going to be helpful for everybody. So this call tonight is going to be talking about what ClearShare offers, the how, right? And then why would you want to even look at a health share? And we know that people have medical insurance premiums that are out of control. And this is an option. And honestly, most people they're not even aware that this type of program exists. So tonight is basically all going to be about the program. Next Thursday, and I will post this information as we are jumping off this call. Next Thursday will be a more focused call on brand partners and how you actually can earn PV for your organizational OGV by referring people to the ClearShare program. And I think that there's a lot of people that are confused about that and they don't understand that. So we're going to talk more about that next week. So this is a customer focused Zoom call tonight. So anyway, so I will hand it over to Abby because she is going to be the one that has all of the information. I will say you're welcome to put your comments in the chat or questions. We will not be answering specific questions to like your medical need or, we will answer general questions, but you'll find when we kind of wrap this up at the end, the best way to see if this program is going to fit well for you is to actually have a 15-minute consultation with the ClearShare representatives. And I will just say, you're not going to be sold a used car. It's not like going into the used car lot. So don't feel like, oh my gosh, if I have this call, I'm going to be pressured into doing something. That's not it at all what anybody has experienced. They're going to be able to take your exact information, look at the plans, and tell you what is going to be the best fit for you. And then you can make an informed decision. So anyway, so I am going to go ahead and turn it over to you, Abby, and then I will watch the chat. So.
All right. Thank you so much. And Susan, you're absolutely right. Our benefits consultants, they are there to walk through like a needs analysis with you and to determine what coverage would best fit your needs. And if you're already on the right plan, we'll tell you. And I think the transparency is part of the reason that Clearwater and Young Living got together, because our values are very similar. And we were able to build a holistic approach to your healthcare to share with you as a part of Young Living. So I am going to just share my screen and pull up a slideshow here. Okay, can everybody see? All right. So Susan gave a fantastic welcome. Thank you so much. Carol, thank you for being here. Like I said, we have partnered with Young Living for almost a year now. And what we are doing with the partnership is introducing holistic and conventional care blended into some revolutionary health plans. You have access to these because you are a Young Living member, brand partner. So this is a quick agenda here, but I know in the interest of time, we're kind of going to skip over some of the partnership stuff to get to the details that you want to know about the plans. What I do want to share though is how they work. So the partnership it allows Clearwater to be able to offer plans through Young Living. So Clearwater is administering the plans, the payments come to us, we manage all of the the claims or the needs requests, things like that. And Young Living supports it by having us on their website and allowing you to accrue OGV and PV and OGV for sharing that out. You can also get it for your own plans. As Susan said, we will go into more of that next Thursday. So some health insurance pain points. They're very expensive with limited benefits, especially if you're not a W-2 employee on an employer's plan. The coverage choices don't always fit what you need, and they are expensive, especially if you have a family. A lot of things aren't covered. It can be time consuming to find a plan. The network is not as large or as comprehensive as the Clearwater network. And there's little to no customer advocacy. And that is another thing that we take very seriously, is taking care of our members. So our results do speak for themselves. Members who choose ClearShare alone save an average of 65% on their premiums. So an additional 80% when it comes to paying out-of-pocket costs. And this will make more sense as we get into ClearShare. Plus with that, like I said, on ClearShare itself, if it's ClearShare only has no network, so you can see anyone you want for care. So this is a good fit for if you are a 1099, an independent contractor, small business owner, freelancer, basically if you're not a W-2 employee who has it through your employer. Looking for better benefits at a better price, this is where you'll find them. Going one step further with Young Living, we are able to help you cover some of those out-of-pocket costs that you may have for your alternative healthcare, like your naturopaths. So there are a few different plan options, and I'll go over the three like basic types. And then, so the one is you can do holistic only, you can do ClearShare only, but we found that a lot of people choose to pair them together. Why they do that is because the holistic coverage allows you to see your naturopath, and it's kind of like your day-to-day driver. It's going to cover those day-to-day needs like your chiropractic, your acupuncture, while the ClearShare steps in for anything that may happen that's more of a catastrophic thing, like a hospitalization or a surgery, things like that. So for the holistic part of the plan, and you'll see there's two holistic options, holistic and holistic savings. We'll go over the main one, which is holistic. Both plans offer office visits, and this can be with your, sorry, I admitted someone and it keeps going back on me. There we go. Office visits at $20 a visit, and you get 5 of those visits for each person on the plan. Why is this different? Because you can see your naturopath, you can see, a licensed naturopath, a doctor of chiropractic, you can see an MD or a doctor of osteopathic medicine that specializes in functional medicine. If, for example, you're seeing your chiropractor and they have other services, these visits are covered at up to $150 per visit per person on the plan. Susan, are you able to see the waiting room as well to see if people are, perfect, thank you. Breast imaging and thermography, this is so important to get done once a year from a preventative standpoint. You are offered one or the other per year per person on the plan. And there is no network care. Your chiropractic and your acupuncture care on the holistic plan or holistic plus ClearShare, you have a combined 24 visits per person per calendar year. So what that means is you can split that out between chiropractic and acupuncture however you'd like. There are 24 visits combined per person. You're going to have a member responsibility of $35 per visit on the plan, but the entire visit is covered at up to $175. So if you're seeing your acupuncturist and they do, for example, some cupping, that extra service can be added on, and the plan, it will cover that entire visit at up to $75 or $175. IV drips, you can, for $25 a month, $100 benefit limit per month, but you can go get your IV drips and all those good vitamins straight into your body there. And that is for both the holistic and holistic plus ClearShare, but it is not available for the holistic savings. One of the main things that was important to both sides of the partnership was to be able to encourage and support Young Living's mission from the Clearwater standpoint as well. So we are reimbursing you up to $75 for a family or a household and up to $50 for an individual per month on Young Living oils and supplements. So things that you're already buying, you just submit a receipt and you get either an ACH payment back into your bank account or a check that is sent to you. Prescription coverages, I know a lot of times we try not to take prescriptions if possible, but if there are those times you do need them, there is $0 generic prescription coverage on the Holistic and Holistic Plus ClearShare plans. The Holistic Savings alone does not cover prescriptions. It helps keep the cost down. But if you're on the Holistic Savings Plus ClearShare, the ClearShare part of that will cover prescriptions after your annual max is met under certain conditions. So that's kind of like your daily driver. You get your naturopaths, your IV drips, your chiropractic and acupuncture, and your wellness reimbursements from the holistic side. The ClearShare part of the plans. So ClearShare is a health share. What that means is a health share is a community of individuals who collectively contribute to help each other with medical expenses. So it is a health insurance alternative. So if you're living in one of the, I believe it is 6 states with an ACA mandate, a health share does not meet those requirements. However, there are ways we can help you with that. However, I just want to make that very clear for those of you in those states. Monthly contributions replace what you would typically hear called a premium. But since a health share is not insurance, we can't call it a premium. So you pay your monthly contribution, and then when you need to use medical services, you essentially, I'm simplifying this, but you essentially pay out of pocket until your annual max is met, and then your needs are shareable by Clearwater. I ClearShare. So, and right here, shares up to 100% of medical expenses after your annual max is met. Now, the annual maxes are $1,000, $2,500, and $5,000. So those are not, I mean, the $1,000 plan, you're going to pay a little bit more each month in your member contribution, but you're going to have to meet less when a medical need arises. A couple of enrollment requirements for ClearShare. A primary member must be at least 18 and they must be under 65 years old. The holistic only plans with no ClearShare, there is no age cap. So you can be 99 and have your holistic coverages and go to the chiropractor and see your naturopath. Dependents can be on a parent's plan until age 26. So how needs are shared? A need is essentially what we call a claim on the health share side. So that's kind of where that terminology is coming in. So a need is an expense that's related to a medical condition. Expenses related to the same medical condition are shared as one need. So your annual max, like I was mentioning, your options are $1,000, $2,500, or $5,000. And this kind of goes through the tiers. There is a family annual max that is with those, but it is not multiplied by each member of your family. And this member plus family, it is any dependent children. It is not up to 2 or 3 children. It is as many kiddos as are your dependents. There are a couple of pre-membership medical conditions to be aware of. Most of the time it is, so you must just be treatment free for the last 12 months for those to be shareable. So the exceptions for that are high blood pressure, high cholesterol, diabetes, cancer, heart disease, stroke, and COPD. The last 4 that I mentioned, the cancer, stroke, heart disease, and COPD, They are only shareable if the condition is regarded as cured and you did not require treatment for the last 5 years. So it's not a hard and fast no, it's just a phase in and waiting period. As I mentioned, the waiting period and the phase in, this outlines it. So year 1 would be 0. There would be 0 coverage for those pre-existing conditions, pre-membership conditions. Year 2, it would be covered. They would be covered up to 25,000. Year 3, 50. Year 4, 125. Hospital and emergency services. Again, this is under the ClearShare part of the plan. These can be like major procedures, accidents, surgeries, ER visits. These are all free after your annual max is met. So if you are on the ClearShare 1000 and you are a family of 4 and you have a hospitalization come up, you pay your $1,000 and your needs are free after that. That's all you're paying. We had a ClearShare member who had some complications after having like pneumonia, was hospitalized for several weeks. His bills were over $2 million and he was on the ClearShare 1000 plan and he paid $1,000. So he could focus on his recovery. He was not worried about going bankrupt or paying all these medical bills or what the fight to get them paid over the next several years. ClearShare covered him. Along with the plans themselves, are included with the plans themselves, I should say, are $0 telemedicine 24/7. It's through an app called Amaze, and this sounds corny every time I say it, but they are amazing. You can hop on with them and the same doctor will follow up with you, doctor or nurse, depending on your need. The same person will follow up with you a couple days after to check on how you're doing. And I think that is such a great touch. Again, $0 for that service. You can also have telemedicine. You can also do mental health services, $0 mental health services with Amaze, which it's pretty incredible. And if you have kids or even yourself, you can skip those sick doctor visits. You just call Amaze and they'll check out your kiddo, whether it's a cut or a cough, and they'll advise you. If they do think you need to go to the emergency room or the doctor, they'll tell you. Pregnancy and birth. So this needs to be updated a little bit, it looks like, but we will share out a maternity one-pager. So if conception occurs prior to membership, that need would not be covered. But if conception occurs after membership, there are so many options on home births, midwifery. It's a really great support for maternity, and we'll share a one-pager in the Facebook group. And if you're not in the Facebook group, I think we're going to share a link to that at the end of the call here. So please join and check it out. This is a really big one that I want to share, care coordination. So with care coordination, on top of all of these other benefits that we've been sharing with you today, care coordination is a way to get your surgeries, your diagnostic testing, your imaging, essentially for free. So what you're going to do is, once you know if you have a pre-planned procedure, you're going to call care coordination, let them know what you need to have. They're going to find a high quality provider in your area, and they are able to negotiate with facilities. And if you choose to go with a provider that care coordination recommends, your out-of-pocket will be waived and you will pay nothing for that surgery. We had this happen with someone who needed a knee replacement. He called care coordination. He had gotten a quote for $80,000 from his provider at a hospital, an MD Anderson hospital. Care coordination was able to, with that same surgeon, get him in at an orthopedic center for $40,000. It saved us $40,000, so we are going to waive his out-of-pocket cost as a thank you for helping everybody keep costs down. So that is care coordination. So quick summary here. I think we're under time. Quick summary. There's no provider restrictions. There's no network that you have to worry about. We are seeing between 30 and 60% average savings when compared with the marketplace. And you're not going to find a wellness, you're not going to find a Young Living reimbursement on the marketplace. I can tell you that much. Does anybody have any, do we have any questions in there?
There was a few questions, but Carol has been awesome. She's in there
Oh.
answering them. So that is super helpful. So, yeah, so if you are still with us and you have a question, we are in the US only right now, Alan. Yeah.
So that's a great point, Ellen. Yes, for care, we're in the US right now. However, join us next week because you can still use the plans to grow your business if you're outside of the US. If you're calling on US based customers, you can still use the plan to help grow your business. And we're going to talk about that next week.
Quick question. I'm sorry, this is Yulia. I do have a question regarding
Sure.
like practically how would I do the plan? If I have two accounts on the Young Living for myself and for my husband, and my husband is signed up under myself, can I make the the health plan on his account? And
Yes.
then request the reimbursement from Young Living from my account. Would that work?
So it would be up to $75 per household. So since you guys are in
Per
the
household.
same house, yeah, per month.
Okay,
though, per household
makes
per month.
sense. So
Yes.
it doesn't matter which account the order is placed on, as long as it's within the household.
Exactly. Yep.
Awesome. Thank you. And then what
Yeah,
does
you're
it
welcome.
mean, $50 to $70 or to $75? Does it mean like on the expense, or how does?
Yeah. So when you purchase your Young Living oils and supplements, you would just send us a receipt. It's fairly easy. You would just upload your receipt, and then we will reimburse you. Say you spend $100. So we're going to reimburse you up to $75. We're going to reimburse you $75 of that $100 for your household's oils and supplements for that month.
I see. But if the order is more, it's still going to be $75.
It's going to be 75. And if you have a household and your order is $60, we're going to reimburse you $60. It's up to the 75.
Up to. Okay, makes sense. Thank you so much.
Yeah, you're welcome.
Mhm.
I see Heather has a hand raised.
Yeah. Go ahead. Go ahead. There you go, Heather. I unmuted you. I asked for you to be unmuted. Sure. Okay. There was
Heather,
actually another question here that somebody had typed. I'm going to scroll back here. Oh, shoot. Now I lost it. Okay. If the provider doesn't accept insurance, oh my goodness. Would I submit a reimbursement? Oh, so never mind. Carol got it. So she said
Okay.
yes. Okay. Sorry.
Nope,
Like
you're
trying
good.
to scroll, but Carol's too fast. She's good. Okay. So Heather, or let's see, there's another person, it just says iPhone. So I will ask that person to unmute since I don't. Oh, okay.
Yep, she knows who she is.
Sure.
I see it. You're not
Okay.
unmuted though. I think you're still muted.
Muted. Okay, sorry, must have unmuted twice and got remuted. But this is Angela, and I have a question. If I have the plan and I travel outside of the United States and need care, I just pay for it and submit that. Is that correct?
So the international coverage, we're not there quite yet, but you can use a maze outside of the US. Great question.
Yeah. Okay. I think Heather actually is unmuted. So go ahead.
Oh, yeah.
Heather. Yeah.
Thank you, Abby. We appreciate all your information. My question is I'm over 65. So as you were going through the presentation, I was a little bit confused with the ClearShare membership versus the holistic plan savings. So my question is there a presentation or a webinar that just covers the holistic plan so I can keep those two services
Yeah.
updated?
Yeah, Heather, what I would recommend is, let me escape out of this here. And can you still see? Oh, perfect. So Heather, this is the Young Living Health Plans website. What I would recommend doing, you can click on this tile right here in the middle that says Young Living Holistic. Do you see where I'm at?
Yes.
Perfect. So this is going to tell you about just the holistic plans. Let me double check one thing. So if you click on book a meeting, you can watch an on-demand webinar as well. So that's just at your leisure. You can watch it when you need to. And there is a holistic specific one.
Okay.
All right. So I think we will wrap things up. So just to clarify, okay, and we'll put some links here in the chat. So you can go to the Young Living website, or you can go to the links here that we are going to share in the chat. There's the link to schedule a one-on-one. That truly is going to be the best option for you to see which one of these plans is going to fit the needs that you have. And so that is going to answer a lot of the questions that you may have on like what is covered and, you know, all of those things. So I see you now. I see you there, Carol. Do you want to add anything at the end
Yes.
here to wrap us up? Because Carol is truly I want to say one of the experts, because she was pivotal in making this come together. So she's probably the one that should have hosted the call and not me, but so maybe you want to just kind of wrap it up and let people know exactly what their next steps are, Carol.
Yeah, I just want to highlight that this is open to any Young Living member, and any non-Young Living member just needs to sign up for a free account. In the US, you can just sign up for a free account. They just need their member number, and then they can sign up for the health plan, and that'll give you OGV. And when they cover that next week, you'll see that this is recurring OGV. So this is a huge, huge thing that Young Living is doing for us. So just my own testimonial, I've been on this since March. We were paying for PPO $2,300 a month for a family of 4, $7,000 deductible per person. Then it got raised to $2,800 right before we quit. We are now paying $940 a month. We're saving over 20 grand just on our monthly bill. And now I'm going to the chiropractor and the acupuncturist 24 times a year because I have that benefit, and we're getting around $700 back a month in our reimbursement. So it is a huge savings for us, and I get to go see my holistic practitioners, and we get our Young Living supplements and oils reimbursed. So it's really, really an amazing program. So definitely look into it. We've created this Facebook group with tons of resources for everybody to use for free. There's printables, there's flyers, there's a webinar that you can share, and it's just everything is awesome. Yes, so I get my massages and I get my facials done on the same day as my chiropractic visit, submit that whole receipt itemized, and I'm getting $175 reimbursed and ending up paying $35 for my chiro and my facial and or massage.
Now we're all going to move to Carol's neighborhood and find all of her practitioners to do this. So that's incredible.
Yeah, it's insane. So this company has the same mindset as Young Living. Like, they want to disrupt the health insurance industry, and the CEO, the medical director, they're very holistically minded. They use Young Living products. The CEO loves Young Living products, but they see the value of being proactive with your health and wellness, with the oils, with the supplements, with all the holistic treatments and all that kind of stuff. They know that by doing all those kinds of things, we're preventing ourselves from having those longer term chronic issues. So they really want to reward us up front by reimbursing us all that money, cash money, like straight into your bank account. It's not like just a Young Living credit, it's cash into your bank account.
Yes, I know Carol's story is like so amazing. So anyway, so I would just encourage you, a couple things as we wrap up. There were a couple questions, so I just want to confirm, right? Carol said, yes, this is open to anybody. It's not just for brand partners. If you have friends that are not yet Young Living members, they just need to create an account right now and get a member number. They can do that without making a purchase of a Young Living product. So that is all they need to do in order to have that consultation and then see if that is going to work for them. So then they will also qualify for that reimbursement. And it is not just a one-time reimbursement. Every single month, depending on which plan you are on, either individual is $50 a month reimbursement on your order, or if you're on the family plan, it's $75. So that is every single month. Okay. So, so there is that. So as I said at the beginning, next Thursday, we're going to have a call that will cover a little bit more. If you are a brand partner, or, you know, maybe you're just a customer now, but you can upgrade to become a brand partner for free, and you could share this plan with other people and you would get paid to do that. And so it's truly a win-win for both sides, because you are going to offer an option for people to get medical care, oftentimes so much less expensive, just like what Carol was saying, than what they were paying, you know. So so I just feel like it's such a great thing, and we need a little more information to kind of connect the dots there. I think for me, I was kind of like, I need a little more information so that I can share this from an authentic place, right? That I really want to help people. So I'm going to drop the information for next week's call here in the chat as well. If you miss it here, you'll see it posted. I'm going to share it in the same places that I shared this call. So look in those places for that. But I think that kind of wraps us up, unless you have anything you want to add, Carol or Abby.
Not that I can think of. Thank you guys so much for having me.
Yes, no, this was great. And like Carol mentioned, and she put the link in there for the Facebook page. If you have you want to poke around and look, there's a ton of amazing resources in that Facebook page. So make sure that you hop in there as well. So I hope to see some of you guys next Thursday as we do another little wrap up here on what it looks like to share these plans as a brand partner and earn PV with that. So, all right, we will see you guys next week. Thanks a lot.
Thank you.
Bye.